Chapter 4, History Taking and Assessment Techniques. This chapter reminds the clinician that good history taking is essential to good diagnosis, and a good diagnosis is essential before any referral or recommendation can be made for medication. When obtaining a patient's history, the importance of good history taking is essential for mental health professionals, especially when the patient presents issues of depression, anxiety, psychoticism, or highly intrusive behaviors. It is critical to take a thorough history from a patient and use assessment instruments that address issues that the patient is presenting. When we're looking at taking a patient's history format, we're looking at various areas, such as identifying the information, the presenting problem, personal/family history, summary of psychometric information, diagnostic assessment, proposed treatment goals, and methods. With the mental status exam, it is wise to obtain a baseline measure of mental status from all of our clients. This information not only gives a snapshot of how the client is doing, but it gives a general sense of the patient's in several different realms, including cognitive capacity, memory, intelligence, impairment, abstract reasoning, and judgment. If we as clinicians do this properly, a good mental status exam can help us predict a client's behavior and provide valuable information. The following are things that should be obtained or sources from a mental status exam. We would like to look at attitude and behavior, stream of mental activity, emotional reactions, mental trend and thought content, sensorium, mental grasp and capacity, general fund of knowledge, judgment, and insight. Patient questionnaires and assessment instruments can also be used. Several patient checklists and questionnaires are available and can be used for clients who present such disorders as depression and/or anxiety. These instruments are designed to be easy to use by both clinicians and the patient. Most of these self-report format instruments are designed to be administered by mental health professionals with at least a master's degree and some relevant clinical experience. Some examples of either questionnaires or assessment instruments are, for assessment of depression, the Beck's Inventory or a Hamilton. There's also a Geriatric Depression Inventory, amongst others. Assessments for anxiety are Beck's Anxiety Inventory, the State Trait Anxiety Inventory, and others. General assessment of personality, including depression, anxiety, and other manifestations, such instruments such as the Minnesota Multifaceted Personality Inventory, also known as the MMPI-2, can be used to assess these areas. Structuring the initial interview is also very important. When we are with a client and the client presents during counseling, structuring the initial interview is also very important. When a client presents for counseling services and a therapist is aware that the client may need medication as a form of treatment for a serious affective, anxiety, or thought disorder, it is very important to gather as much information as possible. We might want to document the client's primary care physician and also date the last time this client had a physical. If the client hasn't had a physical within a year, we might want to refer them to their primary care physician for if the client has not had an examination or has not seen their primary care physician in about a year, we might want to refer them for an examination. Usually examinations consist of blood work, thyroid functioning test, and other basic metabolic and urine toxicology. Another part of a structure in the initial interview is to take a erase. Structuring the initial interview. When a client comes to counseling and presents, structuring the initial interview. When a client presents for counseling services and the therapist is aware that the patient may need medication for treatment of affective anxiety or thought disorders, it is very important to gather as much information as possible. Some information that as therapists we must gather is documentation of the patient's primary care physician and the date of his or her last history and physical. If the client has not seen their primary care physician in 6 months to a year, we might want to refer them to see them so that they can get a complete workup and physical. Typically, tests that are ran during this physical are complete blood count, thyroid functioning test, basic metabolic panel, and urine toxicology. Another area is to take a complete history of any treatment for a presenting problem. So we will want to look at certain problems such as symptoms that like depression, panic, anxiety, and so on. Be sure that the patient has seen and might have had any medication that they've taken in the past for these disorders, and what has worked or hasn't worked if they've had these diagnoses. Next thing, please prepare a complete mental status using other assessment instruments as appropriate to conform your initial impressions. A good treatment starts with a good history and assessment.